Hello, my name is Allison Ozog. I'm one of the recruitment and liaison officers in the Faculty of Health at York University, and I'm so excited for you to join me today to learn a little bit more about the Global Health Program. Just as we start off, some of you may know that the Global Health Program that I'm going to speak about is indeed located at York University. And just to kind of orient us to York University, York University is located in Toronto, Ontario, Canada. It's the third largest university in Canada, which for you as a global health student will mean a lot of choice. So along with global health, there's actually three different university campuses, 200 programs, over 53,000 students from 175 countries, which means if you want to double major or major minor with global health, if you want to study in diverse settings, if you want to take elective courses outside your major, you will have tons of options to do so. As I mentioned, we do have three campuses. However, the Global Health Program is located at the Keele campus in North Toronto. So that picture there, you can see that is a picture of our Keele campus in the summer where it's nice and sunny with a lot of greenery. And York University is the official university partner of the Toronto Raptors basketball team. So let's talk a little bit about the Global Health Program and why it might be a good fit for you. When we talk about studying global health, we are focusing on creating health equity for people worldwide. And when you are studying health equity for people worldwide, you start to quickly see that individual well-being is not just about the food we eat and the exercise we do. There's a lot of external factors, many of whom are greater than the direct control of the individual that affect our access and our ability to stay healthy and to stay fit. So things like access to clean water, healthcare policies, maternal health care, the community we live in, the kind of food that's sold near us, and all these factors operate within and across borders. So, when we're studying global health, when we talk about this, we're talking about looking at the systems and structures within the global context and how they interact and function that can determine the conditions of how we can ensure health and health equity. So, as you can see from the quote from the Prime Minister of Barbados there, Mia Mottley, the pandemic has really shown us that just focusing on what's going on within our country's borders, i.e., national solutions to global health problems, do not work because these issues of health equity are affecting us worldwide, and therefore we need to take a global approach. For the School of Global Health at York University, we are focused on educating the next generation of healthcare professionals, really to be leaders, and specifically looking at complex global health challenges to create positive change. So we are studying topics like the global environment, global governance systems, and global health systems as a whole, but it's not just about the health. It's also taking on an equity and social justice perspective. So if you are looking and you love the idea of creating positive change globally, like this is a program for you. So why study global health at York University? Well, it is a unique program. In fact, it's the first program at the undergraduate level of its kind in Canada. So you're not going to meet like many people who have the same degree as you. It is going to be a little unique, and that can really make you stand out. The focus and the training is focusing on some of the pressing issues and challenges of the world today. So if you like a program that's focused on making a difference, that's this program will definitely have that for you. It's also what we like to say is multidisciplinary or interdisciplinary, i.e., it's not studying global health from just one perspective. It'll take on scientific perspectives, you'll take on social science perspectives, humanities perspectives. You might take more science-based classes, but also classes related to policy and ethics and law. So if you like looking at complicated issues from many different ways, we'll have that in global health. It's a small, tight-knit program, so it's very easy to get to know your fellow classmates as well as your professors, which is great, especially if you want to get involved in research, i.e., you want to push the boundaries of knowledge, maybe get published. Maybe you are looking to get a reference for professional schools later on or make an application stand out. You can do that with us. And we love to highlight our work integrated learning opportunity for our specialized honor students. We have a fourth year practicum. So this fourth year practicum allows you to gain real world experience working with a healthcare organization, either locally or globally. And that is a part of the degree if you're in the specialized honors, but we'll talk about that a little more later on. So what are the program options? This program is offered as a Bachelor's of Arts or a BA and a Bachelor's of Science. And For the Bachelor's of Arts and the Bachelor's of Science, it is offered as an honors. And I bring up this one first because if you have applied and been admitted to this program, you have very likely been admitted to the honors. You can only apply to the honors when applying to this program. But there is also the specialized honors, which has the practicum component, which you can switch into as a current student. It also allows for double majors as well as major minors. So if you want to combine it with another program at York or add on a minor, that is an option as well. So the next big question we often receive is between the Bachelor's of Arts and the Bachelor's of Science in Global Health, what is the difference? They both have the exact same core courses. So everybody in the BA and the BSc, we're all taking anatomy, physiology, agents of change, foundations of global health policy. That does not change. The difference is a Bachelor's of Science student is required to take additional math, science, and computer science courses outside of their global health major classes. So, i.e., the Bachelor's of Science student also might be taking like a mathematics for biological sciences, either a biology, chemistry, or physics, etc. The Bachelor's of Arts student does not have to do this. Okay, so that means they have more space in their schedule, i.e., more flexibility to take electives. Now, granted, your electives can be anything. So if you want your electives to be in those science courses, you definitely can. But you also couldn't choose instead to take them within the social sciences, the humanities, the business, the arts, the languages, whatever have you. Because as I mentioned, York has many, many courses offered every year. But what are the core courses in global health? So these are some of the core courses that are shared between the Bachelor's of Arts and the Bachelor's of Science. So as I mentioned, anatomy and physiology, foundations of global health. You can see there's courses related to global health policy and global health research, the determinants of health, things like epidemiology and chronic diseases and care or communicable diseases, promoting global health. We're also looking at global health governance and leadership, ethics, health and human rights. As well, we have our Global Health Practicum and our Global Health Research Capstone course. And so this is a quote from one of our current students, Sarah. So this is how why Sarah chose the program. So Sarah says, I chose global health because I am passionate about addressing health inequities and finding sustainable solutions to improve the well-being of vulnerable communities. I'm deeply interested in areas like science, medicine, advocacy, and policy, and York's Global Health program combines all these passions into one. So if you are like Sarah, if you are very passionate about improving health and you like this idea of looking at health inequities in particular, you want to combine different science and social science and advocacy perspectives, this is a great program for you. So go into a bit more detail about the program options. As I mentioned, if you've applied to this program and you've been admitted, you've probably admitted to the Honors BA or the Honors Bachelor's of Science. And that is an 120 credit degree. If you had no transfer credits and you're taking 5 classes in the fall, 5 classes in the winter, it would take about 4 years to complete. Uh, this degree requires you to take electives. So there will be space in the schedule to take classes outside your major in whatever topic you want. However, if you are interested in that practicum option, that is the specialized honors, and their electives, there's less electives in this because they're guiding you towards taking more classes in global health. They also have the practicum requirement. And so within the specialized honors, you also are in one of these streams. So you might be in global health promotion and disease prevention, global health and the environment, global e-health, or global health policy management and systems. So if that's what interests you, you're really passionate about the practicum, you can switch into this as a current student. This program also allows double majors. So if you were doing a double major, it actually still takes the same amount of time, still the 4 years, still 120 credits. But instead of doing electives, you would do core courses for the other major as your electives, because now you have more requirements. So you could combine global health and psychology, global health and kinesiology and health science, global health and health studies, whatever have you. This also allows for minors. So if you want to add like a minor in business or marketing, you can totally do that. And global health can be offered as a minor. So if I have a student from another program, they might be in your classes taking it as a minor where you're taking it as your major. So let's talk about that 4th year practicum, which I've teased quite a bit. This is a huge of interest to a lot of the students in this program. Many students will say they chose this program because of the practicum option. So again, it's only open to students in the specialized honors. So as a current student, you'd have to switch into the specialized honors. And this is something done as a culminating opportunity. So it's done in your 4th year, 2nd semester. It's an 11-week practicum and it's 250 hours. It is 4 credits, so it is going to be on your transcript. It can be completed locally or globally. So you will always be working with an organization that has an international focus. Your project will have an international health focus, but the organization itself might be located here in Toronto or it might be located abroad. So those are some sample organizations, but just some sample places I've personally known students to go. I've known students to go to Costa Rica, South Africa. The student in the picture there, she's in the Netherlands. You can see a little bit of the canals behind her. So if you like the idea of working with an organization to test it out, is this the field you like? To gain some work experience, to develop your skills, to potentially get future references, this is a great option within the specialized honors. What might my first year look like? So the first year's schedule for the Bachelor's of Arts and the Bachelor's of Science is actually going to look quite similar because the major classes do not change. So you can see Agents of Change in a Global World, that's a global health course, the Human Anatomy Physiology, and the Foundations of Global Health, that's going to be the same for both of them. Maybe the class is offered in two different options, so you could choose it either like at this time or that time, but ultimately the course itself will be the same between the Bachelor's of Arts and Bachelor's of Science. Um, but this Bachelor's of Arts student, as you can see, they're taking general education courses and electives in their first year. You'll notice that maybe you're used to this if you're coming from a college or a university, but if you're coming right from high school, you might notice that it's different than high school in the sense that each day of the week, the classes are different. And each day, the courses start at a different time. So week to week, the classes are the same, but day to day, they can be different. And so you have some mild degree of control. So for example, this student, because this is a sample, it's not your exact schedule, this student has chosen an elective that's on the Thursday, but that course could have been earlier or later in the day. They could have chosen a course on a different day. You'll notice on the Monday, the day's kind of fairly light, but maybe, they move that class to a different day and maybe the Monday's off. Like it really is going to depend. Our schedule is also the semester runs September to December and then January to April. And then so the summer's a bit longer. The summer is May to August, and a lot of students don't take classes in the summer, but you can if you wish to. Finally, you'll notice with the two colors, the kind of purple one are classes or lectures. So where you have a professor, teaching the subject material. These classes can be bigger, though for the most part, global health classes are fairly small because it is a smaller program. However, the lecture outside the major, it could be bigger because you could have students from any different program in there. The smaller one, the tutorial, which is the green one, that's when we're going to be in a room of maybe 20 to 40 people and we're going over the content covered in the lecture. Usually it's led by a tutorial leader. Usually it's a lot smaller. So this is a sample of what the schedule might look like for a Bachelor's of Science student. And as you'll see, those global health courses didn't change. We still have Foundations of Global Health Studies, still have Human Anatomy and Physiology, still have Agents of Change in a Global World. They, however, are also taking an approved science course outside, some approved science course outside the major. And so that is adding to their schedule because you can see this science course has lecture. There's two different science classes they're taking. So they have two different lectures. They also have a tutorial associated with that. And also that science class they're taking has a lab. So when I say science class, I mean like they're choosing from a list like of biology, chemistry, or physics. And when I say they're in a lab, it's like what you think of in a movie, right? They've got the lab coat, they've got the goggles. It's a wet lab where they're actually like doing experiments, so to speak. But that would be different. A Bachelor's of Science student has to take this. A Bachelor's of Arts student has a choice of what their elective could be. What would my workload be? Most full-time students take 5 courses per term. So 5 classes in the fall, 5 classes in the winter, and that's an 100% course load. But technically full-time studies can be 3 to 5, part-time would be 1 to 2. But let's assume you're taking 5 classes in the fall, that full course load. In class time for 5 courses per term would approximately be about 15 to 20 hours of in-class time a week. So you could see, some classes were maybe about 3 hours, but for that science class we were talking about, for example, where it had the tutorial in the lab, it might be a little bit more than that. But estimating about 15 to 20 hours of in-class time a week is a good starting point. In terms of preparation, because unlike maybe in high school where you maybe do readings, etc., in class, in university, you're expected to do your readings in advance. There's also studying, there's assignments, there's tests, group projects, etc. So you would estimate about 2 to 3 hours of study time or preparation time per course per week, which means on top of that 15 to 20 in class in-class hours, you should also add 10 to 15 study or prep time hours. So altogether, we can probably expect that to be 25 to 35 hours of like in class as well as study time for a full-time course load. So that's how much time you're probably expecting. Your courses will include lectures, tutorials, seminars, and potentially labs if you are a Bachelor's of Science student, or depending on what electives you take. The types of assignments are going to vary because each class can be different. So there could be multiple choice and short answer tests. There could be group assignments. There could be presentations. There could be short written assignments. There can be essays. So it can vary. It depends on the course. So this is a sample of some of the global health faculty. That's the word we use to say the professors who teach in the program. And we love to highlight them here just to also show you the diversity of topics that they maybe teach in, as well as maybe research projects you can work with them on. So you can see some of the professors are focused more on, say, global health policy. Some of them are more on things like epidemiology, maybe program evaluation, community health, or things like global health and humanitarianism. So it's very broad what we are studying within global health because global health can be studied from so many different perspectives. And I really want to highlight research opportunities. This is something that's a wonderful thing you can do within the Global Health program. So not only within your courses are there hands-on learning opportunities, particularly building and applying research skills through, say, global health projects. So knowing how to find the information you're looking for, disseminate this information, and then share it with others is not a skill that everybody has. And it's useful not only in the world of academics, but also in real life. So in the greater professional world as well. You'll have the opportunity to collaborate with experts. So work closely with professors and researchers in York's research units. And so the global health ones we're highlighting here, the School of Global Health, the Global Health Strategy Lab, the Daudelet Institute of Global Health, and the Global Health and Environmental Health Lab, they take and have research opportunities for both volunteers as well as paid research assistant roles. So if you like the idea of getting research experience outside the classroom, potentially working very closely with professors and really broadening your knowledge, developing your skills like leadership, statistical analysis, organization, but also potentially getting a reference down the road, especially if you're interested in applying to, say, I don't know, medical school or graduate study. That's all things you can do with research experience. And so we're just highlighting some research experience here. So we have a student here presenting on research she has done as an independent, as part of a research project. But we also have two articles posted here. And these are articles that you'll notice, like in the first one, the top one, Victoria, and the second one, Rumia, they were current students. So they were current students who were working on a research project with a professor, and now they are published authors in academic journals. So this is what's exciting about research, is that you can be published, you can be adding to the knowledge out there. And so here's Hannah's perspective. Hannah's a current student on working as a research assistant. So she says, I'm currently a research assistant with the Daudelet Institute of Global Health. It has been a very interesting experience to work closely with a professor and other academics in the field and learn the types of projects and research that they are doing. I will be involved in some research next year around TB and climate change, and will definitely add to my list of experiences and will enhance my knowledge as a global health student. So on top of the academics, I mean, we've talked about what you're going to be studying, some of the diversity in the courses we're going to be doing, the differences between the Bachelor's of Arts, the Bachelor's of Science, some of the work integrated learning opportunities. But I also want to highlight the support and resources we have. Of course, you will have access to your professors, the faculty members, whether that's through their office hours or just emailing them or before and after class. But there's also support in terms of peer support. And so whether you are a student using the support or an upper year student who's looking for a leadership opportunity, our Global Health Students Association organizes some of these things. So on the academic side, there's peer tutors and peer assisted study sessions, all free services to help you study for your courses. There's peer mentors would help you with the transition to university. As well, even though Global Health is a small program, you have access to the broader YorkU community. So that includes academic advising to pick your classes, the Writing Center to improve your essays and argumentation, the Career Center, which can be used up to 2 years after graduation. If you have an IEP and you're looking for accommodations, accessibility services, there's counseling services for students, student financial services. We have Black Excellence at York University, York International, the Center for Indigenous Student Services. So this is just a small sample. We don't expect you to memorize it all, but the point here is that we're here to support you. We want you to succeed. So there are a lot of services available. In terms of the career outcomes, some students are using the Global Health Program to go right to the workforce, and others are using as preparation for further graduate study or professional study. If you're looking to just go right to the workforce with your studies, you might be interested in working in things like health promotion, disease prevention, going into policy advising, health research, community health education and promotion, health program planning, or also manager administrative roles in community health settings or health non-governmental organizations or NGOs. Some students, however, are using our program as preparation for further professional study, so especially if you want to be a clinician. So if you want to be, say, a doctor, for example, you do need to go to medical school, and Global Health can be used as the program or the pathway to go on to, say, medical school. So, for example, medical school is an example, but like becoming a nurse in an accelerated program, again, Global Health can be used as the pathway. Law is a good one too. As I mentioned, we focus on critical thinking, a lot of transferable skills, and global health law, global health policy are all in there too. So that could be another pathway. And here's a small sample of some of our graduates. This is not the exhaustive list, of course. These are just four of them. And with these four, Urmi went on to medical school with her studies. You'll notice she went on with a Bachelor's of Arts in Global Health, so that is indeed possible. Gurneet, however, is currently a health evaluation student. So she went on to further master's studies, but she actually worked for a little bit after she graduated. In particular, she was working with an organization who focused on investments, but only in like global health related projects. So that was part of what she did. Humema is a hand hygiene coordinator and data analyst, and Ryan has gone into policy within Employment and Social Development Canada. So just a small sample to give you an idea. So although this is the end of the formal presentation, we are of course here to support you. Many further details about our program is outlined on the Global Health website, globalhealth.yorku.ca. You may email the program directly at sgh, i.e. School of Global Health at yorku.ca. But if after today you have further questions, particularly about accepting your offer of admission, booking an enrollment appointment, or anything like that, I would be happy to assist you. My name is Allison Ozog. I'm one of the recruitment and liaison officers in the Faculty of Health, and you may email me at hlthrec@yorku.ca. So once again, thank you so much for listening to our presentation, and we hope to have you study with us in global health in the future. Thank you.